Researchers have shown us that low levels of vitamin D in their bodies have a strong increased risk of developing cancer. In fact, when you compare people with higher levels of vitamin D with those individuals with low levels, have an 80 to 150% increased risk of developing cancer. Again, research is showing that vitamin D receptors actually regulate a large number of signaling pathways involved in inflammation, tumor growth, and the immune system surveillance for cancer. Researchers are now demonstrating the fact that in cancer cells, these vitamin D receptors are significantly reduced, leaving these cancer cells unregulated and prone to reproduce in an out-of-control fashion. However, treating these cancer cells in culture with vitamin D produces a number of actions that help fight cancer. It decreases this tumor proliferation, it decreases inflammation, reduces invasiveness of the cancer, and stimulates natural cell death, which we call apoptosis. This research has led to a significant number of clinical trials using vitamin D in supplementation in humans. A study that was released in the June 7, 2007 issue of the American Journal of Clinical Nutrition was one of the initial studies that created a significant amount of enthusiasm for vitamin D and calcium supplementation. This study was a 4-year, double-blind, placebo-controlled trial that involved nearly 1,200 women. Subjects were assigned to take either calcium alone or calcium plus 1,100 units of vitamin D or a placebo. After only 4 years, the risk of developing any type of cancer was 60% lower in the vitamin D group. If you excluded the cancers diagnosed in the first year, because these cancers were most likely already present before the study, there was a 77% reduction in all types of cancer in the vitamin D group. Cancers of the prostate also respond to vitamin D supplementation, as shown by a study in which men with early prostate cancer received 4,000 IU daily for a year. 55% showed a decrease in the tumor-positive biopsies or a decrease in what we call Gleason scores that tell how aggressive a prostate cancer is, while an addition of 11% showed no progression of the cancer. Cancers of the colon start as benign polyps that actually progress to malignancy as a result of this chronic inflammation. Patients who had colorectal adenomas or benign polyps who took just 800 IUs of vitamin D3 daily experienced a significant 77% decrease in these inflammatory markers that can promote cancer development. Researchers are pointing out that vitamin D has an effect on at least 200 human genes and is critical in the normal functioning of our immune system and cell division. When there is less than an optimal level of vitamin D, the regulatory process involving cell proliferation and differentiation become defective. This can lead to abnormal cell division and thus cancer growth. However, if individuals simply supplement their diet with 2,000 to 4,000 IU of vitamin D3 daily, they can significantly decrease the risk of all forms of cancer.